We've provided you with the components of congestive heart failure to help you to begin to process complications that can arise from that. So we provided a case study to help you critically think and process those components as a advanced practitioner. We have a 75-year-old widowed African American female. She provides self-care, very independent, ambulatory. She has a past medical history of hypertension, congestive heart failure, coronary artery disease. She's had a myocardial infarction 5 years ago and an ejection fraction of 55%. She doesn't have a history of smoking. Current medications include aspirin, Plavix, lisinopril, and carvedilol. So I'm going to share the case study with you. The home health nurse visits Mrs. Smith today. The nurse immediately notices that Mrs. Smith's legs are swollen. Mrs. Smith states, "I noticed they were getting a bit bigger. They're achy too." The nurse asks Mrs. Smith if she has been weighing herself daily, and Mrs. Smith states, "I got on the scale last time you were here, remember?" The nurse weighs Mrs. Smith and she has gained 10 pounds. Additional assessment findings indicate that Mrs. Smith experiences shortness of breath when ambulating from one room to another, approximately 25 feet, and must sit down to catch her breath. Her oxygen saturation is 94% on room air. Bibasal crackers are heard when auscultating her lungs. The nurse asks Mrs. Smith if she is currently or has in the past few days experienced any chest pain, arm or jaw pain, or become nauseous or sweaty. Mrs. Smith replies, "No, I didn't have any of that. I would know another heart attack. I didn't have one of those." The nurse asks about any back pain, stomach pain, confusion, dizziness, or feeling that Mrs. Smith might faint. Mrs. Smith denies these symptoms, stating, "No, none of that, just a little more tired than usual lately." Her vital signs are a temperature of 97.8 degrees Fahrenheit, blood pressure 165/72, pulse of 96, and her respirations are currently 24. The nurse reviews Mrs. Smith's list of current medications. The nurse calls the healthcare provider, who asks the nurse to draw blood for a complete blood count, basic metabolic panel, pro-BNP, troponin, CPK, and CKMB, as well as an albumin. The healthcare provider also prescribes oral PO furosemide and asks the nurse to arrange an appointment for outpatient electrocardiogram, chest x-ray, and echocardiogram. So some things that you need to think about. We provided some questions. What assessment findings were important? Why are we concerned about back pain, stomach pain, confusion, dizziness, any possibility of syncope? What risk factors were involved? What current medications is Ms. Smith on, and why are they important? How do they interact? What kind of expectations can she have with taking Lasix, and why should we prescribe her potassium chloride? What kind of information do we hope to gather from the blood test, and why do we need additional screening? What are we looking for?